Hello everyone. Today we'll be discussing male circumcision, which is one of the more debated medical decisions that a parent will face early in their child's life. We'll be discussing what it is, going over the research on both sides of the debate, and also discussing why the evidence suggests that it can be an ethically acceptable and medically justified choice in infancy. The image before you is titled The Circumcision of Christ. Circumcision has been a common medical procedure for the past 5,000 years of human history. In the time of Christ, in the nation of Israel, it was common, culturally accepted, and encouraged. So, what is circumcision? Well, let's define it. It is the removal of the foreskin from the penis. Now, throughout this slideshow, we will be showing images of male anatomy. We're doing this to further our understanding of the topic of discussion. Before you is an image of an uncircumcised and a circumcised infant penis. So, circumcision is most commonly done during infancy, often for religious, cultural, or medical reasons. In the U.S., it has historically been done during the first 8 days of a male infant's life. Approximately 55 to 65% of newborn males are circumcised, although rates have declined over recent decades. Rates are highest in the Midwest and lowest in the Western U.S. Globally, circumcision is common in regions with strong religious ties to Judaism and Islam, but uncommon in Europe, East Asia, and most of Latin America. So what are the arguments against circumcision? Opponents generally center on the bodily autonomy, meaning infants cannot consent to permanent body changes. Critics will also note that the procedure causes measurable pain responses and is not medically necessary for all males. Finally, opponents point to the possibility of surgical complications, although these are typically rare. Arguments for infant circumcision often emphasize the documented health benefits. Research has shown that circumcision reduces UTIs, rather known as urinary tract infections. Circumcision also lowers the risk of sexually transmitted infections, including HIV. Circumcision also nearly eliminates penile cancer risk. It is also a practice that will simplify the hygiene of males' anatomy throughout their life. By removing the foreskin, we lower the risk of bacteria and pathogens that would harbor themselves against the penis. So what about the safety and recovery? Well, complication rates, as we know, are very low, well under 1%, and healing occurs quickly, often within about a week. And this is because of the amazing nature of an infant's skin cells. Newborns are born with a high proportion of proliferating skin cells that have a relatively low inflammatory response. Because of this, after the procedure of circumcision, healing is promoted quickly with very little scarring. The pain from the procedure also, while real and measurable, is limited, and this is because of the nature of nerve cells in the tissue around the foreskin. The myelation of the nerves is less robust, and because of this, neural pathways are less mature, meaning the pain is lower and reduced. Often the question comes up, does circumcision reduce sexual function? It's an ethical question to ask, and research has shown that the primary sexual sensation in adults is not significantly impaired following circumcision. In the image before you, you can see the anatomical names of the male penis. When the foreskin is removed, the glans is exposed. The glans of the penis is the neural center and structure responsible for sexual response in males. The foreskin is not. And because the glans remains intact, sexual function does as well. Large cohort studies, time and again, have shown comparable sexual outcomes in circumcised and uncircumcised men. What are the ethics that a pediatrician or a parent should consider when deciding this procedure? Infants routinely undergo medical procedures that cause temporary distress, including vaccination, blood draws, and even airway clearances. Pediatric ethics does not consider brief procedural discomfort alone sufficient to deem a low-risk intervention unethical, especially when potential health benefits exist. Vaccination and blood draws and suctioning are as such. Circumcision falls within this broader category of parental medical decision-making. So why does the controversy persist? Well, despite the favorable medical risk benefits, circumcision remains controversial, and it's mostly because of the emphasis on bodily autonomy, symbolic concerns about bodily integrity, and these concerns are understandable, but they focus more on moral intuitions than measurable long-term harm. The debate frequently centers on ethical framing rather than medical outcomes. Well, you can probably tell what my position is on circumcision. On available evidence, I support my infant male circumcision as an ethically permissible and medically justified parental decision. Research consistently shows that complication rates are lowest in infancy, and healing is fastest during this time. A practical medical consideration for future parents, remember, is that circumcision removes the foreskin, which is a structure of male anatomy that requires lifelong hygiene education and maintenance. Most people do not consider this. In childhood, inadequate foreskin care is associated with conditions such as balanitis and phimosis. And in infancy, it contributes to increased urinary tract infection risk. Please understand that proper hygiene education and foreskin maintenance is required to make a decision whether to circumcise or not. Images before you show what phimosis is. Phimosis is when the foreskin, when not properly taken care of, closes. Closing access to the penis causes discomfort, pain, that will eventually require circumcision. Before you use an image of balanitis. When the foreskin is not properly taken care of, cleaned, boys and men can develop infections that can literally disintegrate their anatomy. Again, the choice whether to circumcise should come down to education, and knowing how to take care of your children is of utmost importance as a parent. Circumcision eliminates these risks entirely, rather than relying on long-term behavior compliance or hygiene instruction. Again, the takeaways. Male circumcision is complex. It involves a medical procedure that is uncomfortable. But medical evidence, ethics, and parental values are also important. Research shows that infant circumcision carries a low risk, it heals quickly, and provides measurable long-term health benefits. ethical frameworks in pediatric medicine support parental authority in such low-risk preventative decisions. While reasonable people may disagree, the evidence supports circumcision as a permissible and medically reasonable choice for parents. Thank you for watching. Before you are the cited references of my research. Thank you.